A young male is undergoing emergency surgery for a clinical diagnosis of acute appendicitis. Intraoperatively, minimal pus was found, but the appendix was normal. What is the next step of management? Search for perforated Meckel's diverticulum. Which of the following is not considered as indicator of adequate fluid resuscitation respiratory rate? In a 65-year-old, double contrast barium anemia shows cancer of colon with an apple core appearance. Colonoscopic biopsy shows adenocarcinoma. What will be the next step of management? CECT to stage the cancer staging. 35-year-old woman present with lump in her upper abdomen for 2 months, which was slightly increasing. She also complained of early satiety. She gave a history of acute severe pain in upper abdomen for which she was admitted to hospital for 10 days. About 3 months ago, on examination, the mass was firm, smooth surfaced, and not moving with respiration. She was most likely suffering from pseudocyst pancreas. While working in a primary health center, an elderly patient presents with a history of sudden loss of vision and curtain falling sensation in one eye. This symptom is highly suggestive that the patient has the following condition: retinal detachment. Pringle's maneuver is done to stop bleeding at hepatoduodenal ligament. What is the most common malignant tumor of eyelid? Basal cell cancer. Which of the following is not a symptom of atherosclerotic occlusive disease at the bifurcation of aorta? Lariche syndrome. Gangrene localized to the feet. Which of the following factors is labeled as cytokine in the pathogenesis of systemic inflammatory response syndrome SIRS? Tumor necrosis factor. Vocal cord palsy after thyroid surgery is due to injury to recurrent laryngeal nerve. An infertile woman presents with yellow or green vaginal discharge, Bartholin cyst, and proctitis. What is the probable diagnosis? Gonorrhea. Absolute contraindication to combined oral contraceptive is history of thromboembolism. A 28-year-old P1L1 presents with severe pain in her abdomen and is taken for laparotomy. On opening the abdomen, pseudomyxoma of the peritoneum is present. What should be the probable reason? Mucinous cystadenoma of the ovary. In 40-year-old woman, Pap smear shows atypical granular cells. The next step of management should be colposcopy, cervical biopsy, endocervical curettage, and endometrial biopsy. A 50-year-old P4L4 has a simple left ovarian cyst of 10 cm. CA125 is 30 U per ml. Treatment of choice would be TAH plus BSO. Total abdominal hysterectomy plus bilateral salpingo-oophorectomy. A 7-year-old girl with precocious puberty is found to be having 10 cm ovarian cyst on USG. The most likely etiology is granulosa cell tumor. A 17-year-old girl presents with an ovarian cyst of 5 cm. The cyst is echo-free, unilocular, and CA125 of 8 U per ml. What is the most appropriate management? Conservative with flow-up ultrasound. The contraceptive choice for a 38-year-old P1L1 woman having chronic hypertension, dysmenorrhea, and menorrhagia is levonorgestrel intrauterine device. The most probable cause of heavy bleeding in a P2L2 during 10th day postpartum is retained bits of cotyledons and membranes. A woman with which of the following health problems should avoid St. Croman polycystic ovarian syndrome? Combined contraceptive pills give protection from the following except cancer of cervix. A woman present with heavy foul smelling discharge with sharply demarcated ulcers without induration on the perineum and labia majora. Inguinal lymphadenopathy is also present. What is the most probable diagnosis? Chancroid. A 28-year-old woman develops amenorrhea after having dilation and curettage. Most likely diagnosis is Asherman syndrome. Which of the following tests is not used for diagnosing syphilis? Fry's test. Fitz-Hugh-Curtis syndrome involving perihepatitis is present in the following: gonorrhea. Which of the following causes bacterial vaginosis? Gardnerella, Mycoplasma, Ureaplasma, Urea laticum. Where are anti-sperm antibodies usually present in? Cervix. Modified Bishop score includes all except position of occiput. The engaging diameter of bro presentation is mantovertical. Intermuscular injection of iron dextran is given by Z technique to reduce the staining.